Hi, my name is Sandy. I have had acid reflux. I had the silent type. I found out from my dentist about 4 years ago. It was literally eating the enamel on my teeth, and it was destroying them. And I couldn't go any further with the dental world because they said that it would even eat the product that false teeth are made out of, even the ones that they implant. Did 3 tests a year ago, December, and found out that I was not only, it was getting up in my mouth, it was eating my enamel, but I was also aspirating it at night. So he introduced me to the Stretta procedure, and I agreed to do it in April of 2013. My symptoms, unfortunately, I had the silent one. Dr. Oz just did a show about 4 months ago on the silent killer, and I'm like, wow, that was me. Because like I said, I found out from my dentist. So I had no indigestion, no heartburn. The only thing I did have a problem with is if I ate like spaghetti products, like tomato sauce, after 6 o'clock. I paid for like 2 days. And garlic and I have never gotten along, so that actually got worse. But the worst part was my voice. It went to a squeak and a whisper, and some words even came out as whistles. And it was so bad, my daughter would say, "Mom, I can't handle talking to you like this." We ended up being like the texting queens. We would text versus talking, and when I got my voice back, we were talking all the time again now. It was just hard for her to handle with me having a voice like that. My throat was sore probably 2 to 3 times a week versus 2 to 3 times a year prior to that. And I went to an ENT, ear, nose, and throat doctor, and he informed me that my vocal cords were white and dry, and they're supposed to be pink and moist. He thought it was the acid also. The aspirating part is what scared me the most. The fact that I was aspirating it into my lungs at night, that really scared me. And the Barretts Esophagus, it had plateaued, but it was still in the negative. So when he mentioned the Stretta, I was very impressed with that. I had a really bad cough, because I used to have to look at people when I was out in public and say, "I'm not contagious, I have acid reflux." And normally in the morning it was very bad, but as the day progressed it got better. It wasn't so severe like late afternoon into the evening. I was also diagnosed with Barrett's about 3.5 to 4 years ago. Yeah, I was taking Prevacid and Prilosec, and they kept moving me around with different meds because they weren't working. When they did the next endoscopy, it was showing up still in the negatives. A little bit of improvement, but not what they wanted to say. Just like the last 2-3 months. And the Barrett's is actually in the plus side, which is the positive side. So it is improving, which is a good thing. I had picked up a few brochures and spoke with my primary on like the one where they take a flap or something and pull it over. And he said, if you're willing to go back and have that reversed, because I wasn't, I guess, I'm really understanding the whole procedure. And then Dr. Noah approached me with a Stretta, which it was non-invasive pretty much. I mean, I had to be put to sleep. There was no prep for it. And I didn't have to go back to have anything removed or changed or reversed. So I was happy with that. I've had 4 back surgeries plus tubal ligation and appendix. So I've had enough surgeries in my life. And I really wasn't looking forward to that. And the way my primary described it, it was not like a hop, skip, and a jump to have the surgeries. And the way the Stretta was explained to me, it wasn't simple. I mean, you still had to be put out. But it was less invasive. They started to put a tube down my throat, but I had no incision and no bleeding and things like that. So it was a lot simpler, and from what I read on it, it had a lot more positive end results. So all that led me to want to have it done. The day of my procedure, I got up like any other day. I couldn't eat. They said I could drink like water. You know, it wasn't like a surgery where you couldn't eat, drink, or anything, or just take a sip with pills. I could do, just no food after midnight. And they put me to sleep and I woke up. And when I went home, I was a little bit discomfort here, but as the night progressed, it became more painful. So it was a little bit more painful than I had thought it would be. But within 3 to 5 days, I was fine. And the most I get even now is like a little discomfort here. But it's not like a burning, like I said, I've never had indigestion or heartburn to even say that that's what it would be. Prior to the Stretta, I was on 60 milligram Dexlant once a day. I stayed on that for several months afterwards to monitor, because he likes 8 weeks to see how the progression is going. It went very well, and then I went to 30 milligrams every day. And then I went to 30 milligrams every other day, and now I'm on 30 milligrams every 3 days. But prior to the Stretta, the medication was If it was controlling, I don't know how extreme it would have gotten, but it wasn't controlling the acid and my voice and things like that, and he was noticing that. When I walked in his office a week and a half ago, he even said to me, "Your voice is great," because my voice was really, really bad. I would suggest, highly suggest that they go for it. I am very pleased with the results of this Stretta. It has been phenomenal, just short of being a miracle, miraculous. And I mean, I'm very pleased that I listened to his suggestions and advice and went with it.